This is Tianyang Liu, and on behalf of the China National Health Development Research Center, I would like to present you what we have did for the last year on the gender project. You know that, let me give you some background of China's situation. You know that caregiving within households is the foundation of health system, especially for the elderly population in China, where 98% of elderly rely on daily care provided by family members and only 2% rely on care from professionals and society welfare institutions. Because of the lack of well-functioning long-term care programs, as well as the historical filial piety tradition, Chinese elderly prefer to rely on family members in their last years of life. So, in this context, we conducted our program, Gender Analysis of Family Care for Elderly. The evidence is from Beijing, China. The aim of our study is to explore gender difference in receiving family care among the elderly and to examine factors associated with the care received. During this study, we used both quantitative and qualitative methods. For quantitative part, we used the results of the Health and Social Support of Elderly project, conducted in 3 districts in Beijing in 2013. In this database, 924 elders were included. Man-Whitney U-test was conducted to comparing mean hours of care received by elderly. Binary logistic regression was used to examine the relationship between care received by elderly and different variables, including gender, especially. In the qualitative part, in total of 18 households were interviewed regarding family informal care. And this 18 household, for these 18 households, we interview one elder and one of their adult children in each household. 9 households were from urban areas, mainly Haidian district in Beijing, and another 9 were from rural areas, mainly Miyun district of Beijing. A customized semi-structured interview guide for elderly parents and their adult children was developed. Our results indicating the following findings. First, elders from the quantitative part. Elders received average of 16.5 hours of care in the preceding 1 week. And men received average of 15.6 hours, while women received the average of 17.4 hours. However, male and female elders didn't differ significantly in care received from family in urban areas in Beijing, and gender was not found to be a risk factor affecting the hours of family care received by the elderly. And one of our important findings is that we found that 22.8% of the elderly didn't receive any care from their children in the last week, so which indicates a transition in the filial piety tradition in China. And factors affecting care received included age, income, education, health status, and number of children. Traditional filial piety was under transition. Traditional supporting for our qualitative parts, results showed that a traditional supporting system was still the mainstream in rural areas. However, there was a transition underway in urban areas. All of the 9 rural elders interviewed were cohabiting with their children, while only one of the 9 urban elders was cohabiting with their children. In rural areas, the traditional form of bringing up sons to support parents in their old age, this is a traditional form. This form was still well accepted in rural areas. Sons and daughters-in-law were still the core force in supporting parents. But on the contrary, In urban areas, 8 out of 9 elders saw that doctors were more reliable than sons. The doctors provided more hours of care compared to sons and daughters-in-law. And so, our results of this study indicated that traditional filial piety was under transition in China, and a large amount of the elders could not get family care from their children. Unpaid elderly care is an important part of the health system, and better understanding of who provides and receives care is important in terms of identifying the weaknesses and gaps in provision and responding with social policy. So, due to this transition away from the traditional filial piety system, social welfare systems such as long-term care insurance and professional care institutions in China should be strengthened so that elderly could receive the care they need. In this study, we didn't check the specific effectiveness of policies such as the long-term care insurance or the compensation for the only child for the parents of the only child when those parents received 16 years of old. But I think further studies should be focused on these issues and this policy effectiveness. So in order so that the analysis will be much more easier to translate into policy, real world policies. Thank you very much.